today we'll speak about internal medicine, and we will talk about viral hepatitis. One of your colleagues said to me, we had last year a lecture on viral hepatitis. That lecture was microbiology. And we always give basic sciences before clinical. That lecture was to prepare you for this lecture. Right? We were talking about microbiology. Today we'll talk in medicine. Diagnosis, signs and symptoms, the treatment, the drugs, complex regimen of the treatment. We will talk about them. So completely different. Overlap, yes, there is an overlap because this information, we cannot talk if we talk only in signs and symptoms without giving you an idea about or reminding notes of the previous thing, you may be cut off the information. So let us start with the الماء كأنه مفتوح هذا؟ لا ما مفتوح كأنه So let us start from the beginning and say what are the aims of this lecture. Epidemiology of the viral hepatitis, classification, manifestations of acute and chronic. So we have to know from the beginning we are going to talk about acute hepatitis and chronic. We'll understand the serological diagnosis, very complex serological diagnosis, and we'll talk about them. Liver biopsy importance and complications of both acute and chronic, treatment, and identify the candidate who requires vaccination. Viral hepatitis. Viral hepatitis is a common cause of jaundice, and we know that. When you see any person with jaundice these days in the hospital, in the Middle East especially, you should think seriously about the viral hepatitis. Some of the patients are anicteric, without jaundice, asymptomatic, without symptom even. And consider, once you see high triaminase, high ALT and high AST, okay, any patient, if both enzymes or one of them is high, consider hepatitis. This is the message. Acute hepatitis, let us start with the acute hepatitis. The clinical picture, okay? A clinical picture. There is a prodromal phase in the acute hepatitis. What is the prodromal phase? Although it is non-specific, headache, nausea, anorexia, jaundice may appear days or 2 weeks before the appearance of the symptom. Vomiting, diarrhea, also common. Another thing, abdominal discomfort, very common. Consider hepatitis if a patient comes to you with these non-specific and abdominal pain, consider hepatitis. Right? Very common. I have seen it in the majority of patients. With abdominal pain, it goes at the end to be hepatitis. Liver tender, slightly enlarged, yes. What are the types of hepatitis? You know, A, B, C, D, E, G, and SEN and TT hepatitis. These are the recent ones. This is viral hepatitis. This is caused by hepatitis virus. Viral hepatitis could be caused by other viruses, Not only hepatitis virus. Look to this point. Very critical. It can be caused by CMV, EB virus. Also can cause hepatitis, but less frequent. Rare herpes simplex, yellow fever can also cause viral hepatitis. This table, I am sure, some of the information you know, but let us talk about A, B, C, D, and E. D, it comes with B, you know this. When it comes with B, the D, it becomes very severe, killer. Now, all of them are RNA viruses, except the B is Hepatna virus. Hepatna يعني hepatic DNA. Hepatna virus. So you can see all of them are RNA. Which is the largest one? Is the B is the largest one, and then comes the C. Here is important thing. Which one can be spread by feces, oral fecal route? A and E. Which one by blood is the B and C? There is no need to say always D. D similar to D, to B. It comes with D. It cannot live alone. It share envelope with the B. So I'm not going to repeat every now B and D. D تحصيل حاصل. Now, which one is common in sexual transmission? B is sexual transmission. Saliva, look, A and B and C can be transmitted by saliva. This is very important. Some people, for example, in the Gulf states, when they greet each other, they put their nose on nose like that. This will spread the virus. There are papers and research work about this, which has been published. طريقة من انتقال vertical. The most common in vertical between mother and fetus is B. These are multiple choice questions, okay? These are not information only. So you should pay a lot of attention to it. And chronic, number one in chronicity is C. B, it comes after, right? The C, even the patient is unaware of having acute hepatitis. No. The first manifestation after 20 years, 30 years of having infection, it appears as a chronic hepatitis. So it's a chronic hepatitis, also B can cause it. Prevention, as you know, vaccine available against A and B. Hyperimmune serum globulin can be given to A and B only. Mild splenomegaly and cervical lymphadenopathy is part of the acute, especially when the acute is caused by EB virus, especially in children. حكينا إنه الفيروسات تعمل أيضا viral hepatitis. Symptoms rarely in the acute exceed 6 weeks, usually less than 6 weeks. Complication, we will see the complication just now. You can see all of these are complications of acute viral hepatitis. I draw your attention to cholestatic hepatitis, a blockage of the canaliculi in the liver, especially with A when it occurs in adults. الأي عادة يحصل بالأطفال بكثرة، بس من يحصل بالأدلت ممكن أن يعمل عنده cholestatic jaundice. Plastic anemia, liver disease, cirrhosis, relapsing, etc. You can read them. Investigation, we say the transaminases, ALT, AST will be increased up to thousands. Bilirubin also reflect the damage. ALP, alkaline phosphatase, here we are not talking about a blockage in the canaliculi. We are talking about inflammation. So ALP increased, but not much, maybe twice. Prothrombin time indicates severity. Prothrombin is formed in the liver. The proteins also formed in the liver. So if you have severe damage, these will decrease. You know this fact. White PC normal with relative lymphocytosis. Any viral infection, lymphocytosis, right? Serological test, we know, we will talk about serological test during the whole talk. Management, hospitalization in acute, rarely required. No need for hospitalization, just supportive. Avoid what? Narcotics, alcohol. You know, narcotics are detoxified in the liver. تمام؟ فأنت liver تبعك يعني already inflamed and damaged, so you should avoid narcotics in acute. Elective surgery also should be avoided until the patient is completely recovered, because it may lead to liver failure. Liver transplantation rarely required in case of acute. Common the transplantation for chronic B and C. Let us start from A, hepatitis A, and saying it is picornavirus, enterovirus, very small virus. The transmission oral fecal route, we said, similar to E. That is why poor sanitation. They usually bring clinical scenarios saying that an engineer person, this is in Europe like that, travel to India, for example, for a work. After a few months he developed so and so. So as if he is telling you in the clinical scenario that there is something wrong in food sanitation or drink sanitation. Infected persons secrete the virus, excrete the virus in the stool. The infected secrete the virus 2 weeks prior symptoms and 2 weeks after the symptoms. So قبل السيمتوم الفيروس موجود بالجسم لأنه incubation period. 2 weeks, 2 weeks. Egg for simplicity. Common in children, as I said. 30 of the adults are already infected. They don't know have been infected. Subclinical infection. A chronic carrier state does not occur. This is very important. No carrier state. In E, also no carrier, very rarely the carrier state in E. While carrier state is common with the others. How we investigate? By antibodies. Anti-hepatitis A. IgM acute, IgG all class. And you know these principles from previously. Hepatitis A is very transient in the blood during the incubation period. So there is no need to look for the virus in the blood. And this virus cannot be cultured. This is another problem. So the diagnosis is serological to detect antibodies. IgM class, anti-A, IgG class, anti-A. M is the acute, present, recent infection. G is the old past infection. يعني أنا لو أريد هلا بعرف أي واحد منكم قد أصيب سابقا أعمل الإم لو الجي الجي. Management, good sanitation, good control. Immune serum globulin, we said it is useful in two viruses, in A and B, to whom we give passive immunity, ready immunoglobulin. We give it to close contact, elderly, pregnant, outbreaks in the school nursery, travelers, الأوروبيين قبل ما يسافر مثلا إلى دولة موبوءة يأخذ. Active vaccination for endemic area. There is vaccine against A, which is very important. children should be vaccinated against AIDS. لأنه من يحصل الأيد بالأدلت في مشاكل كثيرة. شفت أنا مرضى كثيرين كبير يعني بأعمار يعني هيك يعني شباب انصاب بأيد من نشوفها بالchildren very mild disease ويعبر أصلا عنه. من تشوفها بالكبار يصير كوليستيسيس sometimes very severe. أنا مرات أشوف البيليروبين 25 و 30 ملي جرام بير دي سي لتر. Hepatitis B, as I said, DNA virus. It has DNA polymerase. The whole virion is called DAN particle. DAN particle. Now the DAN particle has many antigens, and I will talk about them in a moment. In fact, about 300 million across the world, so it's very common. And even the countries are classified into low, intermediate, high infectivity, frequency. The acute usually asymptomatic, usually, but you may find symptoms in some patients. People are fearful from this virus because it can lead to cirrhosis and can lead to hepatocellular carcinoma. One of the causes of hepatocellular carcinoma is B virus infection, more with C hepatocellular carcinoma. So frequently questions come, hepatocellular, the most common with what? With C, not B. Can occur with B. Vertical transmission, common, as I said, from the mother to the baby. You know, the baby, when born, is immature immunologically. So there is no immune response against the virus. So it passes gradually into chronic hepatitis in children due to the poor immune response. Our immune response can clear the virus if it is perfect. But if it's not perfect, the child will be tolerogenic. If you expose the immune system early, to any antigen in life or development, the patient will be, or the person will be tolerant, cannot mount immune response against it. So there is no inflammatory response in the liver. The cell-mediated immunity will be exhausted, and the viral load will be increased. But once the treatment is successful, everything will return to normal. This is the virus, the virion. This is part of the microbiology, but just to remind you, because it is important. The virus has good envelope, you can see it. So the envelope contains hepatitis B surface antigen. The virus has got a nucleocapsid. This is the nucleocapsid of the virus, and this is the RNA, which is partially double. There is an area here which is not only single. So the nucleocapsid is the hepatitis B core. Look here. هذه بعض الطلاب يقروها C. It's not C, core. Hepatitis B, مكتوب B. يعني hepatitis B core antigen. Part of the core antigen is the E antigen, this black one. The core antigen, this one, cannot go to the blood. E antigen can go to the blood, can be detected, except if the patient has got a pre-core mutation. And I will talk about the pre-core mutation in a moment. And the surface antigen, this one, it can be spherical and can be elongated. So just pick up the important clinical points from this figure, because we will talk about the serological diagnosis about these antigens and the antibodies which are produced against them. And we will have different combination of antibodies and antigens which can tell you at which stage the viral hepatitis is, or the patient. What is the state of the patient? Is it acute? Is it chronic? Is it in incubation period? Is it convalescent? So you have to be aware about these antigens. Presumably, you should be aware about these antigens from your previous microbiology. So you can see here this figure showing that here there is tolerance against the hepatitis virus. This is the virus, so high viral load and E antigen positive can secrete the E antigen, but the enzymes are normal because the body is tolerant to it until the body starts to make immune response against the virus. So B virus will be cleared from the body by the immune response. The immune response by T cytotoxic cells will damage the hepatic cells. And virus does not damage the hepatic cells. Very important point. Hepatitis B does not damage the liver cells. The damage occurs by the immune response. Any virally infected cells will be destroyed by the T cytotoxic cells or killer cells. All right. So here the enzymes will start to increase. Look to the enzyme ALT, AST will be increased. Now here will start the chronic hepatitis process. There will be minimal inflammation. If the immune response is efficient, it can clear the virus. In 90% of the cases. 90% of the cases, the virus will be cleared in the body. In 10% of the cases, the immune system is not able to clear it, and the body will pass into latent phase for many, many years, and then result in cirrhosis. Now, the virus as mechanism of defense is becoming mutated. So the immune system will be less efficient against this mutated variants. And you can see that the virus numbers will be increased. And this mutation, especially it is called the pre-core mutation, the E antigen cannot be excreted to the blood. فكأنما أنت بتعمل فحص راح يطلع نيجاتيف الإي أنتيجين، أنت متصور إيش؟ وكأنما ما في شيء، بينما هو الفيروس in high viral load and the enzymes are very high, and this will lead, if continued, to hepatocellular carcinoma. Investigation, as I said, a hepatitis B surface antigen. It indicates active infection. The virus is present late in the incubation period. And before the prodromal phase can also present in the blood. They stay, the virus, it stays in the blood for a while, up to 3-4 weeks, and disappear. If the immune system is excellent and efficient, it will disappear. But if it does persist, sometimes may persist up to 5 months. The hepatitis B surface antigen. And now, if it persists more than 6 months, this is a chronic hepatitis. شو تعريف الكرونيك؟ من يبقى الهيباتيتس بي surface antigen more than 6 months. 6 months. Okay? So chronicity more than 6 months. هلا بناخذ وجود الانتي بودي against هذه الانتيجين اللي حكينا عليها. انتي سيرفيس انتيجين، انتي اي، انتي كور، انتي كور اوف تو types G and M. هسه ناخذ سيناريو. انتي هيباتيتس بي سيرفيس انتيجين بلس انتي كور اي جي جي، شو يعني لك هذا؟ هذا previous infection. فخلينا نتعود على هالسيناريوهات. الفاكسين كلكم لازم تلقحوا الهيباتيتس فاكسين. كم واحد ملقح؟ Good number. Okay, excellent. The others who are not vaccinated, you are going to hospitals. In hospital, this is common, very common, on the tables, in everywhere. Right? Any touch, you will get this virus. Remember, there is no cure from hepatitis B if established in the body. There is no cure. For C, there is a cure. وراح نحكي فيها بعد. Now, please, if any question, we'll leave it to the end. Just remember it, and at the end of the lecture, you can ask any question. Because if we interrupt the question, the lecture by question, we may lose the point during answering the question. So, vaccine use only surface antigen, which is prepared by genetic engineering, biotechnology. يعني لقاح الفيروس مو مادة فيروسية، مادة مصنعة بالمختبر by genetic engineering. فالشخص الفاكسينيتد ايش تتوقع عنده؟ عنده انتي اي؟ عنده انتي كور؟ طبعا لا، فقط عنده شو؟ انتي سيرفيس antigen. Now anti-core it could be IgM and IgG, and we can differentiate between the recent, current infection, or the previous infection according to the M and G. Hepatitis E indicate active viral infection. يعني لو واحد السيناريو ممكن يجي سيناريو طبعا. واحد يقول لك hepatitis B surface antigen وعنده الاي نيجاتيف، اي انتيجين نيجاتيف، واخر عنده هيباتيتس بي سيرفيس انتيجين والاي انتيجين بوزيتيف. Which is more infective? The E positive with the hepatitis. So E indicate active viral replication. Appearance of the anti-E, it will catch the E antigen. So the E antigen most probably will disappear. Very rarely you see E and anti-E at the same time. Once antibodies are present, it will catch the antigen. Now, chronic hepatitis B, look to the profile. Positive surface antigen and the anticore IgG. E antigen or anti-E. Low viral, اللي عنده anti-E, low viral replication. اللي عنده الاي انتيجين high viral replication. معاي؟ تمام. Exception. Sometimes E negative. This is a pre-core mutation. يعني صار mutation بالكور انتيجين بمنطقة الكور بحيث انه الاي is not excreted outside the virus. Very misleading condition. يعني احنا نعمل فحوصات تشوف الاي نيجاتيف واحد زي ما يطمئن، ممكن يكون العكس، يكون الفيرال لود كلش عالي. وهسه بوجود الريال تايم PCR نقدر نتعامل مع هذا الموضوع. بكفاءة. Look to this graph. The blue one, the blue line, hepatitis B surface antigen. After a while, there will be anti-hepatitis surface antigen, this red one, all right? The E antigen, the yellow one, this is the E antigen. The green one is the anti-E. The purple in color, this is anticore. IgM, which will drop within a few months, and IgG anticore will stay for a long time, right? Look to this area here. It's very interesting. I'm not going to spend a lot of time on it. This is called window area. لا في hepatitis B surface antigen ولا في antibody. يجي لك المريض بالويندو area. Negative for both. أنت شو تقول له؟ روح لدارك واطمئن ما في شيء. وهذا خطأ كبير. You should check for other markers which are present during the window. Anticore, anti-E, right? Which will tell you better idea. Give you. This table مو للحفظ هذا. يعني مطلوب منكم يعني تمام مطلوب منكم. يعني ممكن يجي لك clinical scenario from this table. يعني في واحد لازم يفكر فيه ويتوقع النتيجة. يعني مو حفظ ما ينحفظ. هلا بدي احكي على الهيباتيتس بي سيرفس انتيجي، انتي كور ام، انتي كور جي، ونحكي على الانتي هيباتيتس بي سيرفس انتيجي. واحد من الانكيبيشن بيريد، ايش تتوقع؟ سيرفس انتيجي بوزيتيف وانتي كور اي جي ام. لوجيكال ريسيرش كارنت انفكشن. اكيوت هيباتيتس ايرلي نفس الانكيبيشن بيريد تقريبا. well established سيرفس انتيجين بوزيتيف ام يبدا الجي يظهر لانه اشهر مره. تمام لوجيكال. نروح على هاي الاوكيجنال ما لكم شيء بيها. الكونفاليسنت السيرفس انتيجين will disappear. الام انتي كور بوزيتيف نيجاتيف، الجي will be established انتي سيرفس بوزيتيف نيجاتيف. بينما 6 to 9 months later, which is a long time, there will be surface negative, anticore M negative, يعني M خلاص يعني. G positive, anticore or anti hepatitis B surface antigen will be positive. Very logical. البوست انفكشن يعني خلاص يعني المريض صار له أكثر من سنة، بتشوف عند الأنتي جي كور، الأنتي كور جي وأنتي سيرفيس أنتيجين will be positive negative. الإميونايزد only أنتي سيرفيس أنتيجين. If you look at it in this way, it will be very easy and predictable. يعني تقدر تتوقع. فيرال لود، العلاج الحديث اليوم كله قبل كم سنة هاي صارت مو قاعد. يعتمد على how many viral particles, gain particles, are present in the blood. This can be counted في جهاز اسمه real time PCR. يقول لك هل قد العدد؟ هل قد فيروسات موجودة بالدم؟ و this will guide the treatment. راح نشوف هذا. As a PCR measure the blood virus DNA, which is more than 100,000 يعني 10 power 5 copies active viral replication, usually E positive. If it is less than 10 power 5 copies, this is low viral replication. The patient is surface antigen negative, anti-E positive. Anti-E positive. Now, this requires ultra-sensitive technology in laboratory diagnosis. Except, what is the except? The pre-core mutation. الكور antigen بيحكينا الكابسيد antigen وفي البلاك وانز اللي حكينا عليها الاي. هذا الاي excreted to the blood. If it is not excreted, this is called the pre-core mutation. يطلع عندك E negative, E antigen. A pre-core mutation, which is very misleading, it can lead to a chronic hepatitis. Viral load is important to monitor what? To monitor therapy. الآن العلاج الحديث بالفيرال هيباتيتس بالبي بالذات اوكي يعتمد على عدد الفيروسات باي PCR. PCR identify also يعني الPCR مو فقط يعطي لك الجينوتايب B and C. B and C more aggressive than A. فإذا العلاج اللي أعطيه للB and C more aggressive than A. تمام؟ في فرق عن الميكروبيولوجي كثير. Okay. So PCR more aggressive and less responsive to interferon. The B and C less responsive to interferon. لأنه جزء من العلاج هو الانترفيرون وراح نحكي عليه بعد شوي. هسه مانجمنت acute hepatitis B supportive. العلاج الدراج اوف تشويس الفيرست لاين طبعا هو لاميفيودين. اللاميفيودين doubtful in response, at least pay attention to. Okay. Lamivudine is the drug first line of treatment, and lamivudine effect in acute hepatitis B doubtful. يعني ما في support to use lamivudine in the acute. For recovery is the rule. 90-95% will be cured, as I said. The remaining 5 to 10% develop chronic. Once the chronic occurs, there is no cure at all. I haven't seen one patient cured from chronic hepatitis. Now, vertical transmission become chronic in 90%. Again, immature immunity with the child. A chronic infection is common in immune deficiency and in HIV. Logical. Combined B and D delta very aggressive. كده يعني أنا بقول إن عندي كده. Okay. Chronic hepatitis, no drug, look to this point. We are talking about chronic hepatitis. No drug to eradicate the virus. There is no cure. Now, شو نسوي بالتريتمنت؟ Just to reduce the number of the viruses and to normalize the liver function test. هذا هو الأهم. أما cure ما في cure. Reduce the number of the viruses and normalize the liver function test. Oral antiviral agents are more effective against E negative than positive. طبعا ال E negative هم low viral replication. Cirrhosis can occur in about 20% in 20 years, right? هيك واحد يحفظها 20% in 20 years. Especially when the patient is E antigen positive. لأنه replication عالي يصير عنده. انترفيرون ألفا هي مشكلة الانترفيرون في الدول. أنت تحكي على إذا 5% of the population infected 5%، فأنت لك أن تتصور الأعداد المهولة إذا 7% بعد أكثر من المرضى اللي محتاجين إلى الانترفيرون والأدوية الأخرى. فإذا في جايد لاينز. Most effective interferon when viral load is low and the liver enzymes are high, more than twice. So low viral load and high enzyme, these are best treated with interferon. E positive, the number of patients, 33% become negative with the treatment with interferon and lose the E in 4 to 6 months. If you use it for 4 to 6 months, about 1/3 of the individuals will become E negative. Response rate is lower in E antigen negative regarding interferon. Now, contraindicated in cirrhosis and liver failure. هذه كلها جايد لاينز باستعمال الانترفيرون. يعني أنا لو أجيب لك سيناريو liver cirrhosis أو عند ما يقارب بالهيباتيك فيلر تستعمل الانترفيرون؟ الجواب لا. Not indicated. There is another type of interferon called pegylated. The interferon mixed with a substance which make it long released. يصير عنده long release called polyethylene glycol. بس من باب المعرفة ما مطلوب. Polyethylene glycol, you can give such interferon every week subcutaneously, right? Now antiviral therapy, now oral antiviral therapy or by injection, when you have high viral load and low enzymes. عكس الانترفيرون. يعني من يكون الفيرال لود قليل والانزيم عالي انترفيرون. العكس antiviral therapy. Side effect of interferon, the flu-like, fatigue, depression, irritability, bone marrow suppression, thyroid disease. Better tolerated in patients with B than with the C, interferon. Now the drug or the first line of a treatment for hepatitis B, a drug lamivudine. Lamivudine is part of the treatment of HIV infection also. We'll talk about it when we talk about AIDS. مرات بيجي سيناريو بيحكي لك انه بيشنت كذا سيناريو طويل ده ياخذ لاميفيدين والسؤال هذا وش تايب اوف فيروس؟ مجرد ان حكى لك لاميفيدين بدنا نتوقعك هذا بي. Right? يعني دلاله indirect. So it's a nucleoside analog and that inhibits DNA polymerase. We target the polymerase, الانزيم تبع DNA and suppress the viral load. Improve the liver function in cirrhosis, may prevent the need for transplantation. طبعا الدرug يعني بس أنا في تقديري اللاميفيودين is not that excellent drug. There are more recent drugs which are better than lamivudine, and I will talk about it in a moment. A mutation could occur against lamivudine. So these viruses will be resistant to the lamivudine. This can occur within 9 months or 1 year. Especially there is a mutation in YMDD. These are areas in the amino sequences of the virus called YMDD. Now these resistant mutant are less hepatotoxic, less damaging to the liver. Now, if you stop the drug, the transaminase will be elevated and the virus comes back to its original, may become mutated if you stop the drug, the Lamivudine. واحد صار resistant للاميفودين شو عمل؟ There is a recent drug called adivofir. Okay? Adivofir. It is a nucleotide analog. شو النيوكليوتايد انالوج؟ مين يعرف شو معناتها هذه الكلمة؟ شبيه بالنيوكليك اسيد تبع الفيروس، فالفيروس ينخدع يتصور هذا شيء مفيد له ياخذ الدرج بينما هو درج سام قاتل له. It is analog، يعني مثل ما واحد يعني cheating somebody، لا يعطيه شيء مزور شبيه. لما يدخل على الدي ان اي تبعه it will not function. هذا هو معناه analog. So nucleotide analog inhibit the viral DNA polymerase and can lead to seroconversion of E from positive to negative. طبعا. Histological improvement. Suppress the lamivudine mutant. إذا كان صار عندك mutation بالlamivudine will be suppressed with adivofir. Contraindicated in renal failure. دائما في clinical scenarios يحكي لك قصة طويلة خاصة بالامتحانات الدولية وهي بالنهاية لأنه الأدوفير contraindicated in renal failure. Mutation again to adivofir can occur. هسه حصل مع الاميفيدين، هسه بيحصل كمان مع الاديوفير. Mutation 2% in 2 years up to 18% in 3 years. يعني تقريبا خمس الحالات اللي ياخذوا adivofir in 3 سنوات become mutated. Relapse may occur after you stop the treatment. This tells you the story of a mutation. Look at it. The mutation can occur in the surface antigen. هذا هو surface antigen. The mutation can occur in the polymerase. A mutation can occur in the core, pre-core. This is the pre-core. Can occur in any antigen which is called X. Now, mutation occur in polymerase and in the core, pre-core, and in the surface. شو أهميتها هذه؟ If it occurs in the core antigen, you will get the pre-core mutant. That is to say, E antigen does not appear in their blood. If it occurs in the surface antigen, you know the antibodies against surface antigen, for example, vaccinated people, the anti-surface will not be effective against this mutant if there is a mutation in the surface antigen. هسه صار عندي لاميفيودين اديوفير mutant resistant. شو ساوي؟ خلاص؟ ادراك اخرى ظهرت وكويس هذا انتيكافير and tenofovir. These are nucleotide analog, inhibit the virus DNA polymerase, more effective than lamivudine and adivofir. كأنما المرحلة الثالثة صح؟ And decreasing the viral load in E positive or negative chronic. أيضا يصير mutation. 1 to 2% in 3 years of anti-caviar therapy. Both are used in HIV therapy. القاعدة بالHIV therapy You cannot use monotherapy. Yeah. If you use one drug, the virus will be mutated. أكثر فيروس mutant بالفيرولوجي هو ال HIV. ولهذا السبب ما في لقاح. There is no vaccine. لأنه mutant. Every 3 cycles of replication it becomes mutated. فأنت تتصور بالنهار كم mutation يحصل عندك خلال 24 ساعة. You cannot use HIV نهاية. You cannot use monotherapy. Prevention, infectious, surface antigen positive, and high virus numbers will be very infectious. Now, when anti-E is present and low viral load is the least infectious. يعني أي واحد أكثر infectious إذا E positive و surface antigen positive. حكينا. وطبعا إذا الفيرال لود عالي أكيد يعني خاصة البريكور ميوتن. Hepatitis B more infectious 10 times than the C. And the C 10 times more infectious than the HIV. بمعنى ال B 100 مرة 100 times more infectious than the HIV. Look to the infectivity rate. That is why I am telling you you should be vaccinated against the B. سيرجن ده يشتغل بالعملية على مريض hepatitis B positive who got needle stick or injury by scalp. What you are going to do? هذا السؤال طبعا تعرضت له مرات عديدة طبعا. You should give hyperimmunoglobulin immediately just to protect. At the same time, you give the vaccine. Both of them should be given, right? People who should be vaccinated against B, you know, this is international speaking. Parenteral drug user, تعرفون بأوروبا كثيرا parenteral drug user. Homosexuals and close contact to infected individual. A newborn infected to child to newborn child to infected woman. Patient with on chronic hemodialysis, chronic liver disease, medical staff like you, okay, doctors, nurses, laboratory personnel. Now we come to hepatitis C. We have taken a long time for D, but let us talk about C. RNA virus, acute rare we say, chronic common, transmission of blood transfusion of drug abusers. Investigation, the investigation depends on detecting anti-hepatitis C, antibodies, right? So you can detect antibodies in 6 to 12 weeks after acute needle stick injury. cRNA detection in the blood 2 to 4 weeks of infection. Very short period, only 2 weeks, and then disappear. So there is no need to look for the antigen to the virus. Diagnosis of C is serology to detect antibodies. Genotype 1 is the most common in Europe and less easy to eradicate. احنا حكينا B and C بالنسبة للB. On genotype 1 is more common and less resistant. Who are the people who get the C? Intravenous drug abusers, again. unscreen the blood product إلى قبل يعني 15 20 سنة يلا بدأ سكرينينج بعد أو blood donors أو for C ما كان معروف أصلا السي كان اسمه يعني قبل I نقول 20 years نن أي نن بي لا هو أي ولا هو بي نن أي فأنتوا تسمعوا نن أي نن بي الآن نحكي عليه سي the blood was not secreted for C ولهذا السبب في دول كثيرة الإصابة بالسي عالية حتى كان في بعض الدول من يستعملوا انجكشن مثلا ضد بعض الأمراض المعينة النيدل نفسه يعطيها لأكثر من مريض يعمل انجكشن فيها وكانت وسيلة من وسائل انتشار السي بذيك الدول. Vertical transmission less than B, needle stick, iatrogenic, contaminated vaccine, sharing toothbrush or razors. Razor يعني كاش. Liver function test and liver histology. Liver function test could be normal, could be fluctuating up and down, and usually between 50 and 200 units per liter. حكينا بالبي in thousands. صح؟ هاي أحد الفروقات اللي واحد. Jaundice rarely occur in the early stages. Usually appear chronic بعد 20 سنة ومصر. Management, the aim is to eradicate infection. شوف هذا الفرق عن البي. There is a cure to eradicate infection. Vigilated alpha interferon subcutaneous weekly and plus ribavirin. The drug of choice or the first drug line is ribavirin. نفس الكلام اللي حكيته على الكلينيكال سيناريو انه لو اجاك مريض يحكي لك عن ريبافيرين اذا هذا شو هو most probably or most likely let us say because ribavirin can be used with other viruses also. It's the C virus. The main side effect is hemolytic anemia. Remember this main side effect. Relapse can occur in the first 3 months after treatment if you stop the treatment. Cure. How we define a cure? Loss of the virus for 6 months after completing the therapy. يعني لازم يبقى المريض free of the virus 6 أشهر بعد إيقاف التريتمنت. This is called sustained virological response, SVR. يعني أنت لازم يصل عندك المريض إلى SVR, sustained virological response. Length of treatment, 12 months, SVR 40%. Genotype 2 and 3, 6 months SVR 70%. لأنه حكينا الجينوتايب 1 more resistant. فأنا أعطي ثيرابي لمدة 12 months والSVR 40%. بينما 2 and 3 أعطي العلاج 6 أشهر والSVR 70%. معناتها more responsive. Early virological response, early with RNA negative after 1 month of therapy with a prognostic sign. إذا SVR جيد خلال شهر احنا أمورنا طيبة راح تكون مع هذا المريض. طب في أدوية أخرى أضيفت إلى الريبافيرين، يعني ممكن تعطي الريبافيرين مع الانترفيرون ألفا، وممكن تضيف عليه بروتياز انهبيتورز. وراح نتكلم على بروتياز انهبيتورز وراح بالتفصيل يعني ما راح نتكلم على ال HIV. So protease inhibitor plus interferon alpha plus ribavirin will increase the efficacy of therapy, the cure rate. Now, liver transplantation for resistant ascites due to cirrhosis. The problem after you do transplantation, liver transplantation, which is very expensive operation, very sophisticated operation, recurrence within 5 years of the condition. One of the most recent drugs, which is very promising in some of Arab countries, they are using it excessively. It is called sofosbuvir, which is Sovaldi. Sofosbuvir is a nucleotide analog polymerase inhibitor. Combined with protease inhibitors. شو هم البروتيز inhibitor؟ rivadasvir وليديباسفير. Combined with sofosbuvir, which will increase the efficacy greatly, and these are very promising, curable drugs, right? So sofosbuvir plus rivadasvir or sofosbuvir plus lidibasvir. Progression from chronic hepatitis to cirrhosis in 20 to 40 years. It takes a long time. And the factors which prone the patient to go into this line of progressing disease: immune suppression, males, heavy alcoholic. Now, 20% in 20 years develop cirrhosis. Once cirrhosis is developed, survival will be between 5 to 10 years. This survival rate, 95% 5 years, 81% 10 years. This is a statistic just to have, يعني احنا مو طالبين منك قديش البرسنتجز ولا انا راح اسالكم. بس مجرد انه للمعرفه يعني حتى واحد يتصور انه شو ال complications cirrhosis in 10 years, ascites from cirrhosis. إذا واحد صار عنده ascites, 5-year survival in 50% of the cases. Once cirrhosis إذا cirrhosis occur, شو يصير عندي؟ يصير الشانس تبع الهيباتوسيلولار كارسينوما 2 to 5% per year. واحد من يصير عنده cirrhosis بالسي، بمعنى انه عنده chance ان يصير عنده هيباتوسيلولار كارسينوما تقريبا 5% بالسنة. هذه هي موجودة واضحة وأجاوبك عليها. Hepatitis C endemic in India and Middle East, شبيه بالألف in most of the criteria that I mentioned, except during the pregnancy is devastating, killer. Once occur in pregnancy, it can lead to acute liver failure, and the detection of E is by detecting anti-E IgM. Hepatitis delta, as I said, it depends on B. It cannot live alone because it shares the envelope with the B. Require B replication, and it can cause acute severe hepatitis and also can lead to chronic one. Investigation, you do anti-D of IgM, and then it becomes IgG within 2 months. The D antigen is transient in the blood. If you treat B, D will disappear. If you vaccinate against B, you will be protected against D because it is dependent on it. Hepatitis G virus. وأول كلمة نشوفها hepatitis G virus. HPGV هذا اسم بمعنى human persistent virus G virus. A human persistent. It stays for a long time. وله اسم ثالث GB virus C similar to C. GB في طبيب جراح 1966 اسمه جي بيكر أصيب بهذا الفيروس. فالاسم أيضا كان متوافق مع الجي. So it was named as G. Baker virus. C, it is similar to C. This is envelope, positive sense, transmitted similar to C in the transmission. Very prevalent in blood donors. يعني احنا تقريبا احصينا 13% من البلد دونرز ممكن يكونوا positive for this virus. Co-infection with C doesn't worsen the condition. يعني يبقى المريض على حاله. The role of this virus in human diseases is uncertain because this virus infects lymphocyte rather than hepatocyte. شوف البوينت هاي مهمة. It infects the lymphocyte, not the hepatocyte. The interesting thing in this virus, when it can inhibit HIV virus. So when HIV patient infected with this virus, it will prolong the life of these patients, HIV patients. The reason is unknown. This point is under research, under investigation. It might be useful in the therapy later on. Cell antivirus, these circular viruses. يعني هذه تم اكتشافها discovered in Japan. كيف اكتشفوها in Japan? واحد secrete to all the viruses that on dialysis. We still can get hepatitis. فتم البحث إلى أن اكتشفوا هذه الفيروسات الجديدة which are single-stranded DNA, non-enveloped, and these are called non-A to E. لا هي A ولا B ولا C ولا E, right? Usually in patients on hemodialysis, they are at high risk, may be present with hepatitis C, diagnosis PCR, treatment is interferon alpha plus ribavirin. ولهذا السبب حكيت لكم الفيروس ribavirin. فإذا سألنا most likely, most common أكيد السي، بس هذه الفيروس أيضا could be treated with ribavirin. هذا كلينيكال سيناريو لو أنا جبت هذا بالمينيو أسكي. طبعا هذا كان سؤال بالمينيو أسكي من أول وجبة. هذا المريض عنده جوندس ده ياخذ هذا الدواء سوفوز بافير اللي هو سوفالدي. شو الدايجنوستس هذا؟ هيباتيتس سي. Viral hepatitis clinical features acute and chronic. You can read them: fever, malaise, chronic fatigue, loss of appetite. And these are the vaccines, the hepatitis B immune serum. This graph showing you the chronic infection, how it leads to cirrhosis and how it leads to decompensated liver. You should pay a lot of attention to decompensated liver. And you will have it in your syllabus, and this will lead to death. Any question? هسه كان في أسئلة. عندك أنت سؤال، شو سؤالك؟ تمت الإجابة عليه؟ كويس. مين عنده سؤال؟ If everything is clear, okay. See you later. Today we'll speak about internal medicine